In the past 18 months, more than 170,000 tech workers in the United States have lost their job.
Everyone's distracted by AI headlines and tech layoffs. The year isn't even close to over, and already 179,000 tech workers have been laid off. But here's the difference. Tech workers are being replaced. Nurses are still in demand. The problem is that hospitals themselves are going bankrupt. Right now, 760 hospitals, mostly rural, are at risk of being shut down, and over 300 of them are so broke they could disappear in the next 2 years, especially as Medicaid reimbursements are being cut off under Trump's big beautiful bill, leaving these hospitals even more underfunded. Most nurses will have no idea this is happening at their hospital until it's too late. There will be no warning. They likely won't even know it until the CEO makes an announcement a few days before the hospital has to shut its doors. The good news is that new hospitals are still being built. States like California, Texas, New York, and Maryland are investing heavily in healthcare construction, but those jobs aren't always where you live now. In this video, I'll show you what's really happening behind the scenes, how this wave of closures is hitting nurses across the country, and how to avoid being the next one losing your job. Hospitals across the country are running out of money, not just the rural ones either. Even some big hospital systems are spending more than they're earning. And when their money dries up, nurses are the first ones to feel it. In 2020, hospital margins dropped to some of the lowest levels ever recorded. Average hospital profit margins were likely to sink to as low as -7% by the end of this year. No hospital can operate like that long term without ultimately shutting its doors. Over half of all hospitals in the country were expected to end 2020 with negative margins, and COVID just made it even worse. But here's the part nobody's saying out loud. They cut direct care staff first. Nurses, techs, CNAs, housekeepers, everyone who actually keeps the hospital running. This is already happening. I'll be honest, this whole situation reminds me of why Monica and I left New York in the first place. Back in 2016, we were both working full-time jobs as nurses in the city. And even though we were stable, we were barely getting by. We had debt, we had no savings, and the hospitals we worked at were constantly lowballing our raises and understaffing our units. There weren't any signs that our jobs were about to disappear, but there also wasn't an easy path for us to be better off financially. That's when we visited a friend of ours who had moved to Northern California. He was working for Kaiser Permanente, a hospital up here in Northern California that pays well over $100 for most of his staff. And he had just bought a house with his wife, who is also a nurse. That trip changed everything for us. We applied for our licenses, got interviews, and moved within months. And it wasn't easy. We ended up with over $25,000 in credit card debt just to make this move. But looking back, it was the best decision we ever made, because once we got here, we realized how bad our situation in New York City really was. Had we stayed, we would not be debt-free with a near $1 million net worth at this point. And we definitely wouldn't have built the life that we have now, where we work 20 hours a week and travel as often as we want. But in 2020, 36 hospitals filed for bankruptcy. Another report estimated that over $323 billion in hospital losses happened in that year alone. And today, 314 rural hospitals are said to be at immediate risk of shutting down in the next 2 to 3 years. And this isn't about one of us losing a paycheck. When a hospital goes under, nurses are left trying to figure it out for themselves at the very last minute. Some are forced to travel 2 hours to find another job, because most of these closures are happening in rural areas where there may be only one hospital in a 30 to 50 mile radius. And most of us keep telling new grads that nursing is recession proof, that this job will always be here. But if the hospitals in their area shut down, or if the floor you work on gets downsized, that's only going to make it harder and more competitive for new grads or even seasoned nurses to find work. And most people think this is just a problem for people in smaller towns. You might be picturing one little ER in the middle of nowhere shutting down and assume it doesn't matter. But you'd be wrong, because it matters for the nurses who work there. In the last decade, 117 rural hospitals shut down completely. Emergency rooms, ICUs, labs, kitchens, everything that comes with it. In just the first 9 months in that year of 2020, 17 rural hospitals closed. That's one hospital vanishing every other week. Now in 2025, 314 rural hospitals are at immediate risk of closure within the next 2 to 3 years. And here's why this is terrifying. If you're a nurse in a rural area, you'll likely have no backup plan. There isn't another hospital down the block. You won't be working for a big hospital system that'll give you the opportunity to transfer to one of their other hospitals. When that hospital shuts down, it doesn't just affect nurses. It affects everyone. Both full-time and part-time staff are put out of work. And then come the patients. This part gets ignored most by administrators. When hospitals close, it means that entire areas of treatment are going to go with it. Dialysis patients are forced to travel hours. There's not going to be emergency surgery within reach. Women are going to be left without access to safe labor and delivery care. And if they don't get that care that they need, their outcomes are going to worsen and the death levels in their communities are going to rise. It's not just inpatient services that vanish either. Hospitals have important outpatient functions too, like radiology for diagnosing potentially serious issues, or pharmacies to fill essential prescriptions, or surgical units for both routine and life-saving procedures, and labs that catch everything from infections to cancer. In many of these communities, once it's gone for good because there is no other facility nearby that provides all of these services for them. That's the cost of all these hospital closures. There's a lot of distraction in the headlines that keep pointing to AI as the biggest threat to nurses. But the truth is, most nurses aren't going to be replaced by machines anytime soon. They're being pushed out by bankrupt hospitals, insurance companies failing to reimburse patients for hospital visits, and the lack of government support because of cuts to things like Medicaid, which hurt those who are already struggling the most. Look what's happening with UC San Diego, where they laid off 230 healthcare workers because of mounting financial pressures that are caused by federal impacts to healthcare, combined with reimbursement rates from Medicare, Medicaid, and insurers that fail to keep pace with the true cost of care. When funding gets tight, nurses and lower level healthcare workers are always first to go. AI isn't responsible for that. Administrators and politicians are. This is what's replacing nurses, not machines. And many nurses are still being told that they're in recession-proof careers, that nursing is safe, that it's stable. But none of that matters if the hospitals disappear. None of it matters if you can't find a new job in your area. Even with all these closures, not every part of the healthcare system is dying. Some states are still investing, some hospitals are still expanding, and some cities are growing more in these areas than others. I looked up recent construction data for hospitals, and according to this data, in 2024 and early 2025, states like California, Texas, New York, Florida, Maryland are leading the way when it comes to construction and expansions of new hospitals. Hundreds of new healthcare facilities are either under construction or in pre-construction planning right now. Some of these are full hospitals and others are just outpatient clinics, surgical centers, or urgent care centers. But thankfully, these facilities are creating thousands of new jobs for nurses and other healthcare workers. But here's the problem. Most of these new hospitals aren't being built anywhere near the ones that are being shut down. If your hospital is collapsing in Mississippi or Kansas, for example, you're not just going to walk into a brand new facility in Austin, Texas, or LA, California. You could be living in a healthcare desert while other cities are hiring like crazy and paying $20 to $50 more per hour. What you need to be doing is knowing which counties near you are getting the new hospitals, finding out which hospitals are unionized and stable, checking to see which regions have higher demand and the budgets to back it up. Even with all this chaos in healthcare, nurses still have one thing that a lot of people in other industries don't: demand. Let's just take a look at tech workers, for example. They wish they had the demand that nurses do. Over the past 5 years, the tech world has been in constant crisis. In 2023, over 430,000 tech workers were laid off. In 2024, another 239,000 lost their jobs. And this year, in 2025, we're already at 179,000 and it's only July. That's an average of 492 people per day losing their jobs. Companies like Microsoft, Google, Amazon, Intel, Meta, they've all cut tens of thousands of jobs in just the last 18 months. Some workers were let go by email, others didn't even get a warning. And these weren't interns or underperformers, these were engineers, designers, marketers, and senior leads. And a lot of these employees were laid off. That's why it turns out that there's no such thing as a future-proof job, especially in tech. So what does that have to do with nurses? While tech workers are being cut off in droves, nurses still have leverage. But it's only for nurses who know where to look. Some hospitals are falling apart, others are swimming in billion-dollar profits. Some cities are losing thousands of nurses. Others are paying $100 to $140 an hour just to keep theirs. I'll never tell anyone that this career is invincible. But if you compare it to many others, especially tech, nurses still have way more options. We're still in demand. Hospitals and the patients they serve still need us. If your hospital's collapsing, your pay is frozen, or your ratios are unsafe, you should not be waiting for a pink slip to come before you leave your job. You need to start planning your exit. You need to think strategically. You need to relocate before you're forced to do so. If you've made it this far, you already understand what's coming. Hospitals are closing, budgets are getting slashed, and jobs that felt secure 2 years ago have a higher likelihood of failing today. But here's what's different now. You still have time to move, and you still have leverage, because unlike tech, where 179,000 people have already been laid off this year, nursing still has demand. Hospitals still need us, but only in the places that are planning ahead. Only in the cities building new facilities. Only in the states that are putting funding behind their nurses. Not just pushing us to do more with less. And that's why I built an app called Map My Pay. It's the first app designed to help nurses figure out where the stable jobs are and where they're not. You can compare cities side by side, hourly and yearly pay, cost of renting versus owning, taxes, housing, leftover income, and even where the hospitals are located in your city. If your hospital's falling apart, this app shows you how much better you could be doing somewhere else. So click on the link in the description below and download it. Oh, and if you like this video, then watch this video here where I talk about how Trump's big beautiful bill is going to hurt everyone except for nurses like you and me.